Hi, I'm Lucy and I'm an integrative psychotherapist. Post-traumatic stress disorder is caused by a traumatic experience or a number of traumatic experiences. Symptoms can occur either directly after the event or sometimes, and in many cases, very many years after events. They can be varied, and that's why it can be sometimes confusing to know whether you have post-traumatic stress disorder. There can be difficulty in concentrating, flashbacks, nightmares, what we call hypervigilance, where you feel very anxious or under threat even when doing normal everyday tasks. You can feel irritable and have low mood, and it's a really difficult condition to live everyday life with. So we're here to look at how we can help. So people often ask me what makes a situation traumatic. That depends on a number of factors, and essentially sometimes a trauma event can be trapped within our nervous system with all the sights, sounds and body sensations, and our brain can process things differently. So therefore you could have been through a traumatic event and have had little or no symptoms, but you may experience another traumatic event and find yourself experiencing the symptoms afterwards. So we don't exactly know why particular events are sometimes lodged in the nervous system, but that's part of finding out what the different factors are for you. So you could be in a busy supermarket and be doing your shopping and then find yourself feeling anxious and not understand why. And it could be that your brain has just made the association with being busy and linked back to a time when you perhaps felt more out of control, and that's where the symptoms can come up. Understanding PTSD can be part of how counselling can help. I specialise in a treatment called EMDR, which can be really effective in reprocessing traumatic events in order to reduce your symptoms, help you understand yourself better so that your symptoms don't return, and ultimately heal. The good news is that post-traumatic stress disorder can be successfully treated, and also by having counselling you can help understand what your body and brain is telling you in order for you to be able to cope in a different way, rather than feeling constantly under threat and anxious. So I'd really recommend, if you feel that you are experiencing some of these symptoms, that you contact an expert. You can call us on Counselling Directory. We have a huge number of therapists that might be able to help you to know whether this is something you are experiencing, and look at how we can help you, because ultimately we want you to feel better so you can move on and continue the rest of your life without these symptoms. Thanks for listening.